Okay, I think we'll go ahead and get started. First of all, my name is Cindy Stanton. I'm a member of the Improving Coverage Measurement team, and I would very much like to welcome you here to the launch of the Journal of Global Health collection on improving coverage measurement in low-income settings. I'd first of all very much like to thank you for fitting us into your schedule. I am looking forward to, I think we have a program of interesting presentations, and we're all very much looking forward to the panel discussion at the end. To start out with, I would like to introduce Ellen Piwaz. Ellen Piwaz leads the Data Analytics and Evidence Initiative on the nutrition team at the Bill and Melinda Gates Foundation. She has been working at the foundation since 2007, where her work has primarily focused on research and integrated strategies to improve nutrition in women and children. Before going to the foundation, Ellen worked at the Academy for Educational Development here in DC, and she's also held faculty appointments at Johns Hopkins School of Public Health and also at the University of North Carolina in Chapel Hill. And with that, I'll actually one additional comment I forgot I was supposed to announce. Please, there are USBs and copies of the supplement out on the table. Take as many of you as you like. It's Christmas, you know, just like. They are out there for yours to take, and also a little bit of housekeeping, and that is restrooms are out the door and to the left. So with that, we're very happy to work with Ellen at the foundation, and I'll turn it over to Ellen.
Thank you so much, Cindy. I've been at the Gates Foundation so long I forgot about my prior life. So thank you all for inviting me to this launch event. I'm here representing my colleagues on the maternal newborn child health team, as well as the nutrition teams at the Gates Foundation. And as most of you are aware, the foundation prides itself in being a data-driven organization. We believe that fundamentally that improving the quality, availability, and use of data is critical to achieving global health priorities and the Sustainable Development Goals. So we're so happy to be supporters of this work and of the prior work. I have a sense of deja vu, having been in this room, I think, about 5 years ago on a similar launch event. And we're really happy to be involved with this. 4 years ago, I think during the summer of 2014, the foundation convened a group of MNCH measurement experts to identify measurement gaps and priorities for the transition from the Millennium Development Goals to the Sustainable Development Goals. And I wasn't at that meeting, unfortunately, and I suspect some of you were. So I'm probably telling you what you already know. But these measurement experts met for 2.5 days in Kirkland, Washington, which is a suburb of Seattle. And a key output of that meeting was the creation of what they called the Kirkland Principles, which were then published in a paper in The Lancet. And these were 5 principles for measurement in reproductive maternal newborn child health, adolescent health, and nutrition, I hope, that were intended to guide work in the SDG era. And the 5 principles, as most of you probably know, emerging from the meeting are really central to, I think, what this journal supplement is producing. The first was defining a core set of global indicators for effective MNCH interventions with targets and measurement methods tailored to local settings. I go, check. I think your supplement has accomplished that. The second was relevance. Data about MNCH health coverage has to be useful in the country where it's collected. And I'd arguably say that the papers presented here are extremely useful and very locally relevant. The next principle is innovation, which is to develop efficient and technically sound methods and instruments, particularly for measuring effective coverage in MNCH interventions. Again, the papers cover this quite fundamentally. Equity is a fourth principle, which should be a fundamental component of program design, measurement, and management in order to direct resources to those most in need and at the highest risk of death. And disaggregation is key. And finally, there's a need for leadership to prioritize measurement and evaluation within a global agenda for RMNCH, and nutrition, so reproductive, maternal, child, adolescent health and nutrition, it's a mouthful, and to increase investment in data collection and use. And so I'm really proud to say the Foundation believes fundamentally in these core principles. We're very happy. We call this a supplement, but I have to say it's quite an impressive book that's being launched today, and it truly does embody these principles. The papers are focused, as we'll soon hear about, on improving how we measure key MNCH behaviors and interventions. They address innovative methods for measuring effective coverage, moving away from simple contact with health services to assessing content and quality of services received, which is extremely important. Collectively, I believe they provide important insights on what's needed to obtain valid, reliable, and actionable indicators for key interventions. And they're particularly focused on how data are collected in population-based surveys. Household surveys are vitally important source of health and nutrition information in low and middle income settings, including coverage of key interventions. And as we all know, coverage data help us to understand whether such interventions are reaching those in need, the equity question. And they're widely used for program planning, prioritization, performance-based financing, and modeling of the projected lives saved and health benefits from the work that we're doing. So we're fortunate to have high-quality coverage data from many countries, thanks to survey programs like DHS and MIX, that emphasize data quality and use of evidence to inform questionnaire and survey design. So today we'll hear from a group of researchers from the University of Edinburgh, Tulane University, the Population Council, the London School for Hygiene and Tropical Medicine, Johns Hopkins, of course, and the DHS and MIX programs, who've worked together now for many years to find ways to improve coverage measurement. This research follows on earlier work from the Child Health Epidemiology Reference Group, which the Foundation funded long ago, that we presented here 5 years ago. It's hard to believe it's been that long. So without further ado, I'd like to thank you again for inviting me to congratulate you on the launch of this important body of work, and I'll turn the floor over to Melinda to explain the work in more detail. So thank you all.